My name is Michael Hoffman from the Peter MacCallum Cancer Centre in Melbourne, and it's my pleasure to present this e-poster at the SNMMI 2021 meeting on the TheraP study. This study was designed and conducted by the ANZUP Cancer Trials Group. Lutetium PSMA-617 versus cabazitaxel in patients with metastatic castration-resistant prostate cancer, a randomized, open-labelled phase 2 study. This study was conducted at 11 sites around Australia, and we randomised 200 men who had progressed after docetaxel with metastatic castration-resistant prostate cancer and rising PSA, following central review of a gallium PSMA-11 and FDG PET to either 6 cycles of lutetium PSMA-617 or cabazitaxel chemotherapy. You'll note in the bottom left patient screening, around 30% of men were deemed unsuitable. We think this patient selection and personalisation of care optimises selection for lutetium PSMA therapy. The primary endpoint was PSA reduction over 50%, and this occurred in an intention to treat analysis in 66% of men randomised to lutetium PSMA-617 compared to only 37% of men randomised to cabazitaxel. That's a 29% absolute improvement in favour of the experimental arm. We also saw improved RECIST overall response rates, 49% compared to 24%, and improved progression-free survival with a hazard ratio of 0.63, translating to a 37% delay in progression, either by radiographic PFS or PSA PFS in men randomized to lutetium PSMA-617. In the Kaplan-Meier curve, we can note a widening gap in the curve after 6 months, so that by 12 months, 19% had not progressed with lutetium PSMA-617 compared to 3% with cabazitaxel. In terms of adverse events, we can see a table, and the bottom line is the most critical. Any G3/4 adverse event occurring with a lower incidence of 33% with lutetium PSMA-617 compared to 53% with cabazitaxel. On the right of the slide, we can see deterioration-free survival and patient-reported outcomes, a really important endpoint. Patients completed standardized questionnaires at regular intervals, and we can see significant less side effects, things like skin rash, sore hands and feet, hair loss, altered taste, dizziness, diarrhea, fatigue, social functioning, all favouring lutetium PSMA-617. In summary, in men with progressive disease following docetaxel, lutetium PSMA-617 was significantly more active than cabazitaxel. There were fewer severe grade 3 to 4 adverse events. So lutetium PSMA-617 represents a new class of effective therapy for men with metastatic castration-resistant prostate cancer after docetaxel. I'd like to take a moment to thank our funders, the Prostate Cancer Foundation of Australia, Movember, Endocyte, now a Novartis company, ANSTO, who supplied no carrier added lutetium-177, and the ANZUP and ARTNet Cooperative Clinical Trials Group. The publication in the Lancet is available online, so I urge you to read our manuscript for further details. We think these results complement the phase 3 vision trial, which is just being presented at ASCO. Thank you for your time, and if you have any questions, feel free to shoot us an email.